Eye surgery, you say?
You drink too much Beverly, this is what it does to you.
Yeah! Good man. Bags packed to around the run today. We're really on our way, yeah. Feel like we'll soon explode. Got the good old party mode, okay. Soon we're on our way, yeah. And our friends sure will tag.
That's a surprise. Tom going off for eye surgery. Well, let me assure you, it's a surprise for me too. A few months ago, I had a couple of bright flashes in my right eye and a couple of floaters, and went in, saw the eye doctor. Well, here I am. And he said, vitreous detachment. It's perfectly normal in people ages 40 to 70. And, you know, that's just what happens. And if it stays weird and you see more floaters, come back. No problems, everything cleared up. A few months later, left eye decides it's time for it to do the same thing. And it wasn't quite the same. And you know, a few flashes, but not as many. Little floater things stayed around a little longer, and then things got kind of like hazy windshield, wet windshield looking in like the upper corner of my eye. So after a couple of weeks, I went in, talked to the eye doctor, and he said, yeah, it's like you're like kind of that borderline between normal and not so normal. And normal isn't fun, and not so normal is not good. So he said, you know, maybe a little bleeding in the back of your eye from where things detached, and like yucky things that I don't want to describe. So he said, come back in a week, just want to make sure, you know, I normally tell people 4 to 6 weeks, but let's try you in a week. So I go back in a week, Tuesday of this week, and he says, you know, I think we're gonna let you go see the retinal specialist. And
He did x-rays this time.
oh, they did some very cool inside the eye photographs. Wow, that was a bright light. And look up the machines. They're by Zeiss. They're like $20,000, but they're very cool. And could see exactly what was going on back there. And he said, you know, left eye doesn't match the right eye. I want somebody else to look at this. So we'll see if we can get you in tomorrow to the retinal specialist. Wednesday comes, go in to see him, and he says, well, yeah, you've got that little broken blood vessel in the back, but that's not really the problem. The big problem is you have a detached retina. It's like, what? What even is that? So I guess when this little fluid sac in your eye like detaches from it, sometimes it rips part of your eye, and it did mine. So it's like, well, let's get you in and get that fixed. So they scheduled that for the next day, which is today. So here we are on our way in for, yay, eye surgery.
And what happens if it doesn't get fixed?
Oh, what happens if it doesn't get fixed? The retina continues to peel off like wet old wallpaper from a wall would, and eventually you kind of just can't see out of that eye. So they do some sort of, I don't know what it is, they pressurize, put some sort of liner dissolvable in your eye. I don't even want to know. But once it's in there, you can't change elevations. So we're at about 2,000 feet here. So airplanes are out, and regretfully for a couple of weeks, going 1,992 feet down to Orlando elevation is also out. Okay, everyone thinks surgery is kind of like scary. You know, it'll be over in a couple hours. Life will be good. Not, because part of the process is to get this thing reattached properly. I have to lay face down 24 hours a day for a week. Think about that. I don't have to lay face down. My face just has to be pointed downward. So that is really the part I am not looking forward to at all. But they do make rental things to like help you sleep in bed face down. It's kind of like just the top end of a massage table. And then they also make these like little seated massage chair things you see in the mall that they like send out to you. Oh my gosh, I called these people up yesterday, like as soon as I got back from the eye doctor, and 2 hours later, the box of this stuff was on my doorstep. So that was impressive. Our eye doctor gave me a brochure and said, call these people if you want this for helping you rest for the next week. So I called them, and 2 hours later, a dude showed up at the door with the equipment.
Wow. Ah, so you can read. You can put the laptop there. That's nice. That's good.
And then
You put your knees there.
and this is where I'll be for the next week.
Wow.
So this is the face piece you would use if you had glasses.
Oh, that makes sense.
So you put these on your cheek, each cheek, and then you just lay into it. This is the chest piece for people unlike me.
What do you mean, unlike you? Oh, breast. Breast, you mean? Breast, okay.
Can we use that word?
We can use that word.
Okay.
Oh, and then this is for you
Yes.
when you're not wearing glasses.
This is for humans, normal humans.
All right, so we've moved the coffee table. It's basically going right in the living room. And explain exactly what this is.
It's basically like one of those like seated massage chairs that you see at the mall, but it's a place for me to sit up for 8 hours at a time and have my face planted in a downward direction.
And Disney is making his mark there on the table with his toy. So had to rent this, and how much is it?
$219 for the week.
OMG. And Disney's gonna be happy. I laid his bed right there.
Oh, and the good news is I have just the beginnings of cataracts in my eyes. Nothing abnormal for a person of my sprightly age here. But he said, oh, by the way, the thing we're going to do to your eye is going to accelerate that, and you're probably going to need cataract surgery in about 4 or 5 months. It's like, what? What? Oh, and I can't eat today, of course, and that doesn't make me happy. I can't have my coffee this morning, and that doesn't make me happy. So, go back, search out some of our old vlogs about, what word did you use?
I don't know. What word did I use when?
When she scheduled breakfast for us, and like I didn't eat before the breakfast. When she makes breakfast reservations for like the last 4 minutes that they serve breakfast, I normally eat twice, if not 3 times by that point in time. So
You get very grouchy and yeah.
I earn my grumpy hat. So I'm not really looking forward to this, but I almost am. I'm tired of the just kind of weird things happening in my vision, the lights, the darks, the, you know, somewhat, not cloudy, but, you know, funny looking vision up in the corner of my eye. But yesterday I was sitting out on the back deck and walked out in the backyard, and for the first time I started seeing like some waviness in the grass. We have a very flat backyard, by the way, and it made me a little bit sick to my stomach even. So In that respect, yeah, maybe I am kind of looking forward to getting this done, but I guess that's what happens when retinas are not staying where they're supposed to stay.
So, I was just saying when we came back here that we're kind of reversed. It's normally me sitting on that bed and him in this chair. And he's like, yeah, it's pretty bad that there's a normal for that.
Yeah.
So he's getting ready to change into the gown. So I think I'll turn the camera off.
Are you going to film this entire...
Brought your IV thing, honey.
Oh, great.
Well, I'm sure it's got to be easier to get an IV in you than it is me. At least I hope so.
Better be.
I'm so disappointed in you.
Why?
You could have worn your Chip and Dale underwear, but no, you just had to wear plain old boring underwear. What a disappointment. I mean, while you were under, they could be talking about your underwear, and now they're not going to have anything to talk about.
Thank goodness.
So they put in lots and lots of eye drops. How do they feel? Because they numbed your eye. Do you feel anything?
Not really much anything. Not much.
Yep, we're just hanging out here. They haven't even put the IV in yet because the room he's supposed to be in, the regular pre-op room, they're behind and there's another lady in it. So they're going to wait till they move him like to the regular pre-op room before they put the IV in. They have taken his Haunted Mansion mask and replaced it with one of theirs. And he now has the IV in, which lucky him, only took one poke. So the IV nurse was a new nurse, like that we hadn't seen yet. And she looked at Tom, she said, oh, so the procedure's in the left eye, right? And that's when it occurred to us that, ooh, his eye is really dilated after bukus of eye drops. Wow. It is really, really dilated. I don't know if it's coming off in the camera, but wow. So we are now moved in the pre-op room. They turned the lights out because it'll make his eyes feel better. It's now 12:02. His surgery scheduled for 12:15. I just heard a lot of noise coming through that door, so they must be in there preparing now. And he's just saying right now that his eye is just kind of stinging a little bit. It is 12:45. We're still sitting here waiting. I've been keeping everybody updated on our Instagram account. Do you follow us on Instagram? So I'm having to use the flashlight here, but they put a little mark. I swear it looks like Sharpie. Is that a Zorro sign? I think it is. Hold on. Isn't that the Zorro, that black and white little figure with the black mask sign? I think it is. But anyway, they have to do that to make sure they're operating on the correct eye, which is a good thing because, you know, my mom, when they operated on her lung, they operated on the wrong lung. They opened the wrong lung up and had to close it back, and then they charged her for it. Yeah. 12:59. Doctor just came in about 5 minutes ago, which the nurse had said once he comes in to talk to us, it shouldn't be much longer. So, what are you feeling and thinking now?
My neck is sore. My eye stings. I just want to get it over with.
I know.
1:15, and they are finally taking him back, and he was totally ready. He's like, he does not do well not having his coffee and, like I think I said before, like 2 breakfasts before noon. Unlike me, who's used to not having breakfast, but it is 1:15, so it's actually an hour after scheduled surgery, and so I am ready to eat now. So he had to give me his like driver's license, his phone, his credit card, and I'm like, whoo, I guess I'm gonna go eat lunch. What shall I have? Ruth Chris, maybe? He actually also took his CPAP machine because they said that during, like in the recovery after he wakes up, that a lot of time after being under, people that need that CPAP machine, for some reason they really need it then. So he may need to use it, well, after they take the tube and stuff out of his mouth. So it's there as a precaution. Okay, I have no idea where we left off because my SD card filled up. So I went to Zoe's where Tom likes that chicken salad sandwich. And I got one, I ate half, and saved the other half for him. And then I had to run to Target real quick, and I got another SD card. Was back there within an hour, and when I got there, he was still in surgery. And it was running over a little bit. So, but everything went well, thank goodness. So, I have a little present for you. I'm gonna put it under you and you open up. See? I got you the chicken salad. Do you want to try and eat it now?
I don't think I can.
You can't? Okay, I didn't think so, but just so you know, I got it for you. So he said you should not be in any pain. So, are you not in any pain?
Nothing significant.
You can probably feel that darn tape pulling at your skin. I can see it.
Yeah, I feel a little odd.
Just like heavy or?
Just kind of, yeah. Just little twinges of not really pain, but
Like twinges of nerve sensation?
I can't tell if it's that or what.
Okay, well, let's head home. So what I'm really praying for is that I don't have to slam on the brakes.
That's two of us.
Yeah, he said that's two of us. So do you remember like how long it took you to go to sleep? Like what they said to you or anything?
No.
You don't remember anything? Do you remember waking up? Wow. So what's the first thing you do remember?
Guess leaning forward on a table.
Okay. Which, of course, you were already in that position when they brought me in. We got home at 4:30. A lot later than anticipated. That is why I am having to film this as I'm driving. And no, I'm not looking at the camera. I'm actually looking at the road. Because I have to run. I got him tucked into bed. And I am now on the way to pick up Lakeland's birthday cake, because if you follow us on Instagram, you know that it is Lakeland's birthday today. We were actually supposed to be going out of town to do something, but of course, you know, as of yesterday, we found out, oh, that's not going to happen because, you know, hey, you're going to surgery tomorrow, that type of thing. So everyone is meeting at my parents' house to have birthday cake and for Lakeland to open his presents. So again, I need to go get the cake, and within 50 minutes I'm supposed to be at my parents' house. It was quite interesting getting Tom dressed in the recovery room because, you know, he really couldn't, you know, obviously couldn't even put his shoes and socks on. The next thing that I'm going to video is basically later tonight to see how he's doing. He's you know, you heard him say that he's just feeling, his eye is feeling weird. The doctor said he should not have any pain, but what's bothering him right now is his head. He has a headache. I think the reason for that, and he agrees, is most likely because he hasn't had any coffee today, he hasn't had any food, and that on a normal day, if he goes too long without those things, he gets a headache. So that is probably what that situation is. Tom called me after I'd left the grocery store, and he's really having a hard time getting comfortable, and that's mainly because he says, like, the eye patch, which he can't take off, is like pressing up against his eyelid, and that's what makes it uncomfortable. And then of course, if his face is in that thing, that's making his eyelid, the patch, brush against it even more. So at this point, he says the most comfortable thing is to lay across the bed with his head like hanging off the bed. I will include Lakeland blowing out his birthday candles in the outro music. I actually FaceTimed him at the grocery store and had him pick out his own cake, which is not something we normally do, but I was gonna get his cake yesterday, but just with what happened, I couldn't. So I was like, hey, we'll make this birthday, it's already a little different, so we'll just let him pick out his own cake. So watch through the outro music and you'll see a little bit of his birthday and what movie I'm taking him to see, since, you know, we couldn't do the original plan. You'll see that too. Get home from the movies and I find Tom on the sofa like this. Ended up he could not get comfortable in the bed. And in the morning I found him like this. Now we're off to his follow-up appointment to get his patch off.
Perfect. Stuff on your eyelids off, okay?
Okay.
So tilt your head back for me just a little bit so the water doesn't run into your mouth. All right, this is gonna be really, really chilly, so be prepared for that. Okay. All right. All right. Can you cover up that right eye all the way for me?
I can't tell.
Okay. Can you see the screen at all up there for me?
There's a white blur on the wall.
Okay. All right. If I'm holding my fingers up here, can you see how many fingers I'm holding up?
It seems like one, maybe.
Okay. Anything back here?
Yeah, I can see a hand, but not really counting fingers very good.
Okay. All right. I'll take that from you. Got one more. I'm gonna kind of hold your eyelid here just a little bit.
Okay, so now he's officially on 4 eye drops. So these two are twice a day, four times a day. Antibiotic and anti-inflammatory. And then these two are twice a day, and this is dilator, keep his eyes dilated, and some pressure, anti-pressure medicine. So every time eye drops go in his eyes, he has to keep them closed for 5 minutes. So this is actually 2 days after the surgery, and swelling has went down and some redness has subsided. Okay, so the 2 day after update.
So, well, when she just put in the second drop, when you look up, you start, I see like this black...
Gonna stop here for a second. You see that green band he is wearing? He has to wear that until the bubble in his eye actually dissolves, because if he was in some type of wreck or something like that, medical personnel needs to know that.
Smooth but jagged outline, And it's like, you almost wonder, it's like, is that why you look down? Because is that the bubble starting to peel away from the retina and you're seeing the outline of that when you look up, or what's going on? It's just so weird. You see so many different things and you don't know if they're good or not, and it just weirds you out.
So you haven't addressed if you can see out of that eye yet.
I can see very fuzzy shapes and whatnot, but you know, I can tell that's a hand, but I can't even tell how many fingers I'm holding up. Sometimes, like this morning, I could see my phone somewhat clearly, but yeah, it's very fuzzy still.
Subscribe and hit the bell notification button so you don't miss when we upload his week update.
So stoked we are getting done. Bags packed, so we're on the run today. We're really on our way.
He knows he's gonna get a. He knows he's gonna get a Funko.
Got the good